I'm just going to pull the curtain. Do you still live at 123 Fake Street?
Yeah.
And who do you live with?
Your parents.
Okay. Can you tell me what's wrong?
I hurt my elbow.
Okay. Which elbow?
My right one.
All right, Ainsley, can you tell me how that happened?
I got tackled during rugby.
Okay. Did they do anything to treat your elbow at the field?
They gave me ice.
Okay. Do you have any limitations in your arm?
I can only bend it to here.
All right. Do you feel any tingling or numbing in your arm?
No.
All right, Ainsley, so what makes the pain feel better or worse?
It feels better when I hold it, but it feels worse when I bend it. I tried to put on my sweater and I couldn't.
Okay. What does the pain feel like? Are you able to describe it for me?
It's like a shooting pain whenever I move it.
Okay. Where exactly in your arm is the pain? Can you point to it?
It's all in my elbow.
Okay. So on a scale of 0 to 10, 0 being no pain at all, and 10 being the worst pain you've ever felt, how can you rate your pain?
I'd say probably 7.
Okay. So what time did the incident actually occur?
12 p.m.
So like 2 hours ago?
Yeah.
Okay. So what do you think about this?
Well, I'm worried because I have a rugby tournament next weekend and I want to be able to play.
Has this ever happened to you before?
Well, I've sprained my ankle once before, but it's a completely different pain.
Hi there, I'm Nurse Lisa, and I'm just here to check your range of motion, okay?
Okay.
Can I see your wristband, please? Can you say your name
Ainsley Campbell,
and your date of birth?
January 16th, 2001.
Good. Ainsley, do you have any allergies?
No.
No. Okay. And do you know how tall you are?
5 foot. Nothing.
Okay, so we're just going to test your range of motion, okay? I'm just going to inspect your elbow a little bit. Yep. There's some bruising around there. Is it a bit tender?
Yeah.
Yeah, okay. So we're going to do range of motion next, okay?
Okay.
Can I just have you sit up for the range of motion, please?
Okay.
Okay, so I'm just going to move your arm gently like this. Okay, and I'm just going to palpate while you open and close. I'm just feeling your joints. Open and close, okay? That hurts? Okay, we won't go as far. Okay. I'm just going to discuss some things with my fellow nurses and we'll be back with a health plan for you. Hi, Nicole.
Hi.
Hey, guys. We're just here looking over at the general survey of our patient Ainsley. We hear you're going to see her in a few minutes.
Yep.
Okay, so we'll just go over everything with you so you know, okay?
Sounds good.
Okay, so Ainsley appears to be younger than her stated age of 16. Her sexual development is appropriate for a girl her age. She's alert, oriented, responding to her questions appropriately. Her skin is intact, she has no lesions, and her skin color is even and varies with her genetic background. Her facial features are symmetrical with movement, and her pain is indicated by some facial distress during range of motion.
So I'm going to give you the information of her body structure. Her height is within normal range of her age, and her weight is also within normal range of her age. Her height and body build is good. Her fat is distributed evenly. Body parts are equal bilaterally and are relative proportion to each other. She has slumped shoulders and just a mild case of scoliosis. She's in semi-Fowler's position in the bed right now, and she's also holding her right elbow with her opposite hand. Her body build is proportionate, and she has no other physical deformities.
Good.
I did range of motion on her, and she seems to be moving okay. She can move it to about here and then to about here. I palpated to feel for any crepitation, and I didn't feel any.
All right, so I'll talk about her behavioral assessment. So she does maintain eye contact with us when we're speaking with her. Her expression is appropriate for her situation. She's cooperative and interacts pleasantly. Her speech is clear, understandable, and fluent. She uses an even pace and appropriate word choice and talks in her native language. So her clothing fits her body appropriately, but of course she's a little bit dirty because she was at rugby practice when this happened.
Filling me in, guys. I'm going to go in there and I'm going to show her a couple of exercises to promote her health and help her heal faster.
Good.
Hi, I'm Nurse Nicole, and I'm going to be your health promotion nurse. Can you tell me your name?
Ainsley Campbell,
And can you tell me your date of birth?
January 16th, 2001.
I'm just going to bring you down for your x-ray so that we can find out what's wrong with your elbow. Back from your x-ray, we have some results. The physician looked over your x-ray and determined that you actually have a hairline fracture on your elbow. So the arrow right there is actually pointing to right where your fracture is.
But what does this mean for rugby?
So the physician recommends you take at least 4 weeks off of rugby. I'm just going to check the doctor's orders to see what we're going to do next. What have we here? The doctor wants me to put a sling around your arm. I'm just going to go get the sling, okay?
Okay, thank you.
I'm going to put your sling on for you now. How does this feel?
It feels good.
So I'm going to be showing you a couple of ranges of motion, and in about 7 days I'd like you to try them at home. I'm going to have you go like this, and then like this. I want you to come back in 4 weeks and we'll do a checkup.
3 weeks later.
How does this feel?
Feels okay.
Good, you're making a great recovery.